Well, we're staying with COVID-19 related matters because Sunday will mark 14 days since the country was moved to adjusted level 4 lockdown with a number of stricter regulations. Over 21,600 new cases have been recorded in the last 24 hours. South Africa is now sitting at over 2,179,000 cases. Now, that's a gloomy picture. Should government move lockdown levels or the current restrictions are actually bearing fruits? We speak now to Professor Adrian Puren, head of the Center of HIV and STIs at the National Institute of Communicable Diseases. Prof, always a pleasure having a conversation with you. Tomorrow we're expecting, should we say, a media briefing by the President Cyril Ramaphosa regarding where we are as a country since placing us under alert level 4. As you gauge what is happening with the spread of the COVID-19 infections as well as the Delta variant, are we ready to adjust levels at this time, whether higher or lower?
I think it's going to be a really difficult decision, I think, given that, in fact, I know that in Gauteng at least it looks as if the peak has been reached, but remember, you've just quoted that still accounts for about 50% of the cases, so that's still a substantial number of cases. We're also seeing a marked trajectory in terms of the Western Cape, as well as some of the other provinces, such as Limpopo, as well as Mpumalanga. And of course, the consequences of this is a great deal of number of people that are being hospitalized, and also an outcome is certainly mortality rates as well being on the increase. So I think it's going to be a fine decision as to how to make that type of decision. I know that there's this dichotomy or balance between having an open economy and that many people are struggling versus the fact that we have these high numbers of cases, the consequence of which is the strain on our hospital systems in terms of hospital capacity, oxygen supplies, and so on. So I think it's really going to be a difficult call.
Let's talk a little bit about some of the other provinces, Prof. The likes of, for example, Mpumalanga, where it accounts for about 6% of the cases, the Eastern Cape and Free State 3%, Northern Cape, for example, lowest 1% of these COVID-19 related cases. To what do we attribute these figures to? Is it because people are adhering to lockdown regulations, or is that there's not enough movement between people and therefore the virus perhaps is contained in those other provinces?
There could be multiple factors. I mean, as you know, you've seen the geographic changes, so they may well certainly, I know that certainly if you look at provinces such as the Northern Cape, the Northwest and the Free State, there's still ongoing transmission, even though the Northern Cape is certainly coming down. So I think there are still increases in cases that we may well see, but you're quite right. It may well be that other factors have certainly contributed to this, such as the limitations of movement, but as well as the fact that perhaps in previous resurgences there may well have been a high degree of immunity, for example, and that certainly may well be protective. Whereas, for example, in provinces such as Gauteng and within the Western Cape, perhaps the differences there are greater mobility as well as a lesser degree of immunity. We did not take into account the fact that the Delta variant was in circulation, so that may well be a contributory factor, at least in some of these particular provinces. So again, remember, it's certainly the Delta variant has suddenly become highly dominant, and this may well change in some of the provinces where it's not reached the extent that it has, for example, in Gauteng.
Now, as you look and you gauge the vaccination rollout program, I know that some facilities are now open on weekends. Is it enough to bolster improvement when it comes to catching up to the months where we were lagging behind with the vaccination program? Are we doing enough to almost mitigate against those delays that we were experiencing previously?
So I think for this particular resurgence, it may well contribute, but maybe not to the extent that we would like to have seen. But certainly, I think that opening facilities on weekends will certainly be an important contributor, especially if you can reach numbers such as 240,000, if not 300,000 per weekend or per day. I think that will certainly contribute to at least trying to minimize particular future waves, such as a fourth wave, for example. We've seen the effectiveness of such approaches when we look at, for example, the UK, the United States, Israel, Chile, for example, that have really been able to, through a high coverage in terms of vaccine coverage, certainly made quite a marked impact in terms of the actual numbers that they were actually seeing. So it can be quite effective to reach once you have high coverage.
And also, on the other side of it, Professor, is being able to maintain and manage, so to say, hesitancy around actually taking the vaccine. The teachers' union have reported how some of the teachers are reluctant to take the vaccine, though the numbers have been opened up now to about 35-year-olds to about 49-year-olds. But we certainly need to do a lot more in order to make people aware of the benefits of taking the vaccine so as we can cover enough ground for immunity, as you would say.
Absolutely. So the hesitancy question is an important question that needs to be addressed in South Africa, just as in many countries. And it's how we approach it. It's a matter of engagement, reassurance, trying to make sure that people are aware of the correct information rather than through Twitter groups or chat groups where conspiracy theories certainly take hold. So I think it's not about fear. It's really about encouraging people to see the benefits of vaccines in terms of not only at an individual level, but also at a broader community level. We know that vaccines are protective for the individual in terms of having milder disease, avoiding severe disease, hospitalizations and death, as well as the fact that these vaccines have also been shown to limit forward transmission. So I think there are a whole range of benefits of these vaccines. We do know that these vaccines have gone through rigorous testing in terms of being approved. Therefore, the side effects are really minimal and should be minimal. And in fact, within a space of at least 24 to 48 hours or 72 hours, those side effects, whether they be localized or generalized, should actually dissipate through the use of, for example, medications. There are very, very rare events that have certainly been documented, but these again need to be in context of what the actual benefits are for vaccination. So I think it's really engagement with those who are hesitant and provide the reasons and to listen to their reasons for vaccine hesitancy and manage those.
Prof, you know, as we're going through these numbers of COVID-19 and the Delta variant as well as its effects, on the other hand, we have to be conscious of how many lives are lost every single day as a result of this virus. Is there any way, and here I'm asking you to look into your crystal glass or your expertise, of avoiding the number of lives that are lost due to COVID-19 on a daily basis? Unfortunately, it's getting to a point where it's just numbers, but these are people's family members. Any way at all of avoiding, unfortunately, this kind of fate?
Yes, it comes back to, you know, what you started off by asking me. What is that decision going to be made tomorrow? And it comes back to the fact that we have to limit contact. We have to limit the fact that if there are events, congregant events, therefore, you know, events such as larger scale meetings, indoor events, these events contribute through super spreading events, for example, or super spreaders, to actually leading to disease. So I think the majority of us will have a mild or moderate disease course, but I think we need to think about the effect that, in fact, we have a proportion of our population that are in the older age categories that have comorbidities such as diabetes, heart disease, and so on, respiratory disease as well. And those are the people that are, there may be a proportion, they are a significant proportion of our population, but we need to keep thinking about that. So I think it comes back to the fact, regardless of what that decision is tomorrow, it still comes back to the fact that we need to be wearing our masks, we need to be physically distant, we need to be in places where there's good ventilation, we need to have hand hygiene. So all these particular factors are key factors. They will continue with us for a while. Even though we have this vaccination program ongoing, complacency will be a problem if we do not follow these particular guidelines and adhere to them in order to prevent the strain on our hospitals, because that leads to an increased capacity where it becomes unmanageable very often, leading ultimately to poor care and poorer outcomes.